You know, getting a headache during pregnancy can feel like a really cruel joke. I mean, on top of everything else, now this, but it can also be a source of some real anxiety, right? Making you wonder, is this just another annoying symptom or is it something I actually need to worry about? Okay, let's dive in and get some real clarity on this.
So that's the big question, isn't it? Is this headache just an annoying but totally harmless part of the whole pregnancy journey? Or is it your body trying to send you a really important warning sign? We're going to break down exactly how you can tell the difference. First things first, let's start with some good news. For the vast majority of people, headaches are an incredibly common part of pregnancy, almost a staple, really. And there are some very clear biological reasons why that is. And this is probably the single most important thing to hear right off the bat. Most of the time, that throbbing in your head is not a sign of something dangerous. It's really just your body adjusting to all the massive hormonal and circulatory changes that are happening to, grow a whole new person. What's pretty interesting is how the reason for these normal headaches actually shifts as your pregnancy goes on. So, in that first trimester, it's all about that initial surge of hormones and a huge increase in your body's blood volume. But later on, say in the third trimester, it's often more, mechanical. Think poor posture and just general tension from carrying all that extra weight around. And beyond those big trimester-specific causes, the list of potential culprits is long and honestly probably looks pretty familiar. It could be something as simple as cutting back on your morning coffee, not drinking enough water, feeling stressed out, or even just a change in the weather. These are all totally normal headache triggers. Okay, so we've established that most headaches are nothing to lose sleep over. But now we need to talk about the exception, because sometimes a headache isn't just a headache. It's a signal that you need to pay very close attention. And that brings us to the most critical part of this whole discussion, the preeclampsia red flag. This is the one condition where a headache is a primary warning sign that you absolutely positively cannot ignore. So, what exactly is preeclampsia? Well, to put it simply, it's a serious blood pressure disorder that only happens during pregnancy. And the real danger is that this high pressure can start to damage vital organs, like your liver and your kidneys, which poses a serious risk to both you and your baby if it isn't treated. And here is the key difference. We're not talking about a dull ache that kind of fades after a little while. The headache that's linked to preeclampsia is often described as severe, persistent, and one that doesn't get better with the usual remedies. It's a headache that just feels different. Now, looking at the timeline here is also really important. According to the American College of Obstetricians and Gynecologists, that's ACOG, preeclampsia usually shows up after the 20-week mark. And while it can happen anytime in the second half of pregnancy, most cases actually pop up right near your due date. Or, and this is a crucial point that a lot of people don't know, it can even happen in the postpartum period, after the baby is born. So this brings us to the most practical part of our chat. How do you decode the signals your body is sending? What are the specific signs that mean you need to stop what you're doing and call your doctor or midwife, like, right away? Here's the most important thing to remember. A preeclampsia headache almost never shows up by itself. It's usually part of a whole constellation of symptoms. So what you're really looking for is the headache plus something else from the official warning list. And this is the full picture. These are the official warning signs from ACOG, so pay close attention here. If you have that severe, persistent headache, plus you notice things like sudden swelling in your face or hands, or you're seeing spots or other changes in your vision, or you have that specific pain in your upper belly, that is your signal. Any of these symptoms combined with that headache means you call your provider immediately. Do not wait. Okay, so let's shift gears and pivot back to the more common, run-of-the-mill headaches. Knowing how to tell the difference between dangerous and just disruptive is step one. Step two is having a solid plan to manage the everyday ones so they don't completely take over your life. But before we get into that plan, I just want to reinforce this main message with a quote from neurologist Dr. Matthew Robbins. The takeaway is so simple. When in doubt, check it out. A severe headache always warrants a conversation with your healthcare provider. No exceptions. All right, so for those non-worrisome headaches, here are some really proactive steps you can take. It's all about mastering the fundamentals, really. Try to notice your triggers by maybe keeping a little log. Stay hydrated. It sounds so simple, but it's huge. Keep your blood sugar stable with regular meals, find ways to manage your stress, and really try to prioritize sleep. These simple, consistent habits can make a massive difference. Ultimately, all of this really comes down to one thing: listening to your body. You are the #1 expert on what feels normal for you and what doesn't. So the real question is, when your body sends you a signal, whether it's a whisper or a scream, are you prepared to really listen and act on it?